You're listening to Online Pet Health Podcasts with Dr. Megan Kelly. Continuing education for veterinarian rehabilitation therapists. Learn more at onlinepethealth.com.
Hey Vetrehabbers. Now, one of the things we need in order to treat our patients optimally is a relaxed patient. It's really hard to be effective when we're treating patients that are tense. Veterinarian J Foote joins me today to chat about stress-free handling. She gives some great tips on how to handle those nervous dogs, as well as suggesting some products we can use in our vet rehab practices. Sally offers online courses and in-person training in stress-free handling, and you can find out more at drsallyjfoote.com. Before we head over to the podcast, I want to say a few thank yous. Firstly, thank you to Yaz of Yorkshire Pooches Therapy for the shout out about the podcast. Yaz, if you're listening, please email me at meg@onlinepethealth.com for your limited edition veterinary rehabilitation mug. So if you are listening to this podcast, please take a screenshot, post a story on Instagram and tag at Online Pet Health. We love hearing from you, knowing that you're listening every week to the Veterinary Rehabilitation Podcast. A second thank you is to our amazing sponsor, Wiggleless Back Braces. Wiggleless is owned by Ben Blecker. Ben is such an integral part of the community and is always so supportive and keen and ready to sponsor education and learning for our vet rehabbers. So a big thank you to Ben. Here are some words from our sponsor. Maximize your dog's life and reduce their pain with Wiggleless Back Braces. Just because your dog is aging does not mean your dog has to live in pain. A back brace can provide mild support and help stabilize your dog's spine by decreasing excessive motion. This stabilization can lead to decreased inflammation and irritation to the spinal nerves. All good news for your dog. You can learn more at wiggleless.com. Now, I've also seen some vet rehabbers getting really excellent results using the Wiggleless back brace in degenerative myelopathy cases. You can see Wiggleless back braces as well as all our other sponsors at this year's Vet Rehab Summit. It is our online veterinary rehabilitation conference. You can bookmark the date now. It's the 12th of November. Online Pet Health paid members, you get free VIP access to the event. If you're not a paid member, you can purchase day access, and you can find out more at vetrehabsummit.com. So right over to my conversation with Sally. Hey, Sally, thank you so much for joining me.
Hey, thank you so much for inviting me to your podcast. I'm excited to talk to you.
Sally, please can you introduce yourself and just tell us what set you on this journey of finding a better way to work with our patients?
All right, well, thanks. So my name is Sally Foote. Dr. J Foote. I'm a veterinarian and I'm also an animal behaviorist. I am certified by the International Association of Animal Behavior Consultants. I'm also low stress handling certified, fear-free elite certified. And so I graduated in 1984 from the University of Illinois. So as you could tell, I have a little bit of experience in this field of veterinary medicine, primarily in small animal medicine. I was in general practice and owned my own general practice here in Tuscola, Illinois. Tuscola is a small town of about 4,500, which is small for Illinois, here right in the middle of the state. I grew up in the Chicago area, practiced in the city, and then there was opportunity for my husband and I to move to a small town nearby. It happened to be near the University of Illinois. Anyway, on my journey was that kind of culmination of life, if you will, that I had one of my bosses in Chicago early in my career, second, third year of my career. He just intuitively, if you will, himself said, there's no sense in trying to have 2 or 3 people pile on an animal to hold him down just to get whatever, the IV catheter, the this or that, or nails, etc., done. No, we're going to sedate him. We're going to just find another way, and he had kind of little tricks and ways of getting a cat with a blanket. So it was very intuitive. And then, it sparked my interest. And why is the animal behaving this way, and how does this just sort of change and approach, and just stopping the nonsense. I'm sorry, that was where it was at in 1988, improved how the animal responded, which then helped to decrease our risk of injury, as well as you could get a better exam. So then when I was on my own, in my own solo private practice, now I was in control of my life, right? I could determine how I wanted my practice to be. And again, it was a little bit of, I didn't want to, be just like, hey, let's try to get as many appointments in as possible. Just try to get it all done. I saw that sense in let's have the client included in this, use some, if we need medication, have them come in for happy visits. I'd say, you are welcome to come in at noon and we'll just toss some treats at your dog and go home, to change the meaning. So then, over that time, I attended a lot of continuing education and behavior as part of, the regular continuing education you have to get. And my focus was always on how can we prevent problems and how can we make this moment, this time of the animal in front of us better. So that was my journey.
Yeah, it's so interesting. If I think back to vet school, I mean, I recall doing like animal behavior, but it was always about like how animals behaved with one another or like signs that they show, but never really about handling. I mean, and
Yes.
maybe I just forgot that. I mean, I'm trying to think now, did I actually learn that? Did we learn about how we could improve our handling and how we could look at the way the animal was behaving? And I don't recall learning anything about that.
I agree with you. Yes, we did not receive any kind of, okay, so we all received a formal training in the approach to the abdomen, a surgical approach to the abdomen, say in a small mammal, dog, cat, whatever, rabbit, or large animal, right? You can do a paralumbar incision, right? You learned where to stand, where your anatomical markers were and all that, right? Yet we didn't learn for a physical examination how to approach, how to walk up, how to put your hands on, not formally. I remember a few, and I can tell you, when I say a few, I'm talking about 2 or 3 of my teachers in vet school making any kind of comment as to, okay, whoa, before you go walking up to that horse, make sure you come from the side, or let's stand back and watch the horse just walk around. Like assess, this is how you're going to assess their gait, and also assess how is he interacting, with his space. Is he spooked? Is he scared? Let's get him in a quiet place. He's showing that he's upset because we don't want you getting kicked. It was literally 2 or 3 out of how many, 30 or 40 educators. And I remember too, because I just posted a link to a recent article from Clinicians Brief about the effect of stress on the leukogram on the CBC. I went, oh yeah, Dr. Dorner talked about just stress in general, making these changes in the CBC. And he did say, like, hey, it's not only about like what illness is going on with them, but where are they living? What's going on around them? But again, it was just kind of incidental. It wasn't any part of our education, which is frankly kind of senseless.
It's crazy. It is crazy. I think for me, I actually did veterinary nursing before I did veterinary.
Okay.
And I think that most of my knowledge about behavior and handling actually comes from my veterinary nursing training.
Yes, that's right. Mm-hmm.
And I think that, like you say, I think a lot of it was practical training. And, as a veterinary nurse, I think veterinary nurses are a whole lot more attuned to how the animal is responding to their handling, because the veterinary nurse is usually the one that is helping hold so that the vet can do whatever they can do. So, as we're chatting now, I'm thinking like, that was really beneficial for me actually to have done veterinary nursing first and then go into veterinary. And one thing which I remember in practice, when I was doing general practice veterinary, I used to, and I've never owned a cat in my whole life. So it's just nothing, it's not an animal that my family have ever wanted. So I've never had a cat. So the only cats that I ever met were in practice. But I used to always be very good with cats. And people used to say, oh, take it to that doctor in that practice because she's great with cats. And I used to wonder, why am I so great with cats? And I think now probably was because maybe of my veterinary nurse training, but I was always just very sort of attuned to how they were and their stress, and I was never wanting to ever pin them down,
right?
Because I sensed straight away that cats don't like that. So I would just work with them as they were going around, and they liked that, obviously. But maybe it was that veterinary nursing training that was coming through, which maybe I just wasn't even aware of.
I think that's absolutely true. It's kind of, I don't know, there's almost this separation, if you will, from say and that separation I see has become stronger kind of with every decade. Remember, I graduated in the 80s, now we're in the 2020s, whatever, but stronger as the technology increases. So there's like the doctor is seen more as the one, just read the ultrasound, read the x-ray, read the blood work. Yeah, you do the physical exam, but the the value, if you will, and the emphasis on those. What are you feeling when you touch? What are you observing? Yes, you have all this data, but I call it observational skills. Like the whole observational skills and touch and hands-on, that hands-on type care, if you will, is just now almost cut out from the DVM degree. And because it's the assistant, the technician, the nurse is the one who's going to do like the handling, do the nursing, et cetera. And so therefore they're doing all the hands-on stuff, like almost this separation. And so, yes, the technicians, whether or not they're formally educated in it, are much more in the trenches, if you will, right in it, with a lot more of the hands-on. And I think, yes, they do have more of that observational skills. They really need, well, we both need it. We both need it. And that's, I guess, part of my thing is to remind us all, we also need this too. We're like partners in a dance. It's not just put it all on them.
So, Sally, how do you think your understanding of behavior has changed the way that you examine and treat your patients?
Oh, completely. And when I say completely, it's integrative. I don't mean it's to exclude or say, well, this animal is too stressed to be able to do certain procedures, because there are times that they're going to need, they come in sick, they're vomiting, they're diarrhea for 3 or 4 days. And maybe they're showing tension or stress about needing to put in an IV catheter to hydrate them. You're going to need to get the IV catheter in. Yet understanding, okay, this dog is now ducking away and trying to, pull away and hide behind the handler. If I start to approach, I realized, okay, we need to give them maybe like the pheromone to help calm them. Let's get in the quietest corner and spot to eliminate the noise stimuli. Can we give them some oral transmucosal, just a little squirt between the cheek and gum of pain relief, and then wait a half an hour and then put in the IV catheter? Or maybe even say, you know what, let's see if we can get on some sub-Q fluids to get some hydration that'll help make putting in the IV catheter in an hour or 2 easier. Like we'll, be more successful. We all know what it's like on a very severely dehydrated animal to even get the IV catheter in. While then we also allow like the pheromone to work. We allow, the pain relief to work. And then we're going to come back with something that's more involved for handling, like putting in an IV catheter just is, because we can't reschedule that in 2 or 3 days. And we may not want to put them under total sedation because of their physical, and health status right then too. It might be very risky. So understanding that behavior and what can I do in this immediate moment to strip away the triggers, as well as add in whatever pain management and anxiety management, medication, supplement, pheromone products to make this interaction better. That brought it all together. Boy, it was kind of just like, And I love that, because now whatever I learn more about pain management, neurology, development, nutrition, aging on the body, the brain aging effects, body aging effects, again, it still brings it all together, in care.
Yeah. For us as veterinary rehabilitation therapists, it's so important that our patients are relaxed and they're not anxious, because it's really difficult for us to treat them. And we have a lot of time, luckily, to treat them. So like we're not that rushed, although we have a lot to achieve in that 45 minutes, usually half an hour to 45 minutes, sometimes an hour that we treat them. We've got time, which is on our side. But we do need them to be relaxed. And when they're tense, it's very difficult for us to be able to help them. And luckily, usually what happens is, we spend a bit of time with them. We might see them 2 to 3 times. And then as we start to see them, they start to realize this is actually a calm space. This is they're not trying to hurt us. They're actually trying to help us. But every now and again, we get those kind of cases, which for whatever reason that they're triggered, something that is happening at our practice triggers them, and we don't get them to get in that calm state when they come. What tips can you give us to help to overcome that anxiety? And maybe we could split this up into dogs and cats.
Sure.
and even horses, if you've got some tips for the horses. So maybe we can split it up into species, because we've got our small animal vetrehabbers that are treating many cats, dogs, and rabbits and things like that, and then obviously our equine practitioners.
Right. So the like pain, I'll say the pain management specialist, the rehab specialist, you are building a relationship with this animal, which is wonderful, because in building the relationship, these repeated visits, they're on a regularly scheduled, whether it's once a week, and then, there's a regularity to it. So that's how it builds on the experience for this animal. And that's how, and you or your staff accommodating the needs specifically for this animal, that's how they can improve and do well. That initial exam though, that's probably, the toughest one, or the kind of, we just got to figure out where we're starting from, right? And so if they are already a bit anxious or they are in pain, the pain may not be well managed, that's why they're coming to you. What can we do? Remember that noise sensitivity is increased in the animal that has body inflammation and pain. So always think of, we've got to make the area wherever we're at, the entry, the arrival, and coming into your space, to be the least noisy as possible. So oftentimes, if and travel too, of course, we can give tips to help the client with traveling to the patient. But that's why sometimes, especially for cats, because they're even more, they already have, behaviorally and neurologically are more sensitive to noise. And so now if they're inflamed, let's have them come in the back door. Let's them come in a different way. Have them maybe wait out in the car until you're ready to directly escort them into an exam room that's farthest away from the ringing telephone, from other maybe barking dogs or people talking or laughing loudly. And that was actually, I think, one of the benefits of all this curbside care during the pandemic, was many practices saw the benefit of not having animals waiting in the waiting room, because that's where the phones are ringing, other animals are, they may hear the barking, people talking, etc. There's actually a fair amount of stimuli, so I would say that's one of the first things. The second thing is, I think of using the pheromones like the Feliway and Adaptil especially. I don't think Adaptil gets enough credit for the benefit of it. Use it early and use it often. Meaning, I personally prefer the sprays over the plugins, because remember, the pheromone has to get absorbed through the roof of the mouth, and that's how it channels directly to the calming center of the brain. So using it on a bandana that you put on the dog, even or any kind of if they have a harness, spraying it directly on the chest piece, because now it's going to evaporate, from underneath the chin to go to the roof of the mouth. Have the staff spray the front of their smock and their forearms. Also the same with the Feliway Classic. Feliway Classic on the blanket to cover the carrier. Again, the cat doesn't see the stimuli, but now the cat's going to get that sense like, oh, I guess I've been here before. And also the Feliway Classic carries the feline friend pheromone. So now when you've sprayed on your forearms and your smock, the cat says, I must have met you before. You're not so scary. There is the Feliway Optimum now, which is the plug-in that combines both the Classic, which is a marking pheromone, and the feline calming pheromone in a plug-in. Now that I think is good to have in the exam room, because then that really helps the cats there. They do not make the Feliway, it's called the Feliway Multicat. They had appeasing pheromone in a spray yet, but that's why to use that. So I think those two things, like, let's make the environment and space, especially for entry into the exam area, and then use our pheromones, even if they look like they're feeling okay. Because as soon as we start to do any kind of even assessment, the palpation of the body, or feeling and palpating any joints, we now might be triggering the pain response. And that will increase anxiety and even can cause aggression. So anything that we can have on board ahead of time to help minimize that is going to synergize with our pain relief strategies and other anxiety reducing medications or anything.
Before you carry on, I think that for those people that are not used to using these products, can you just summarize the difference between Adaptil and Feliway, and then just those different types of, if you can just run through again the different types of
Sure.
Feliway for us?
Okay, so Adaptil is the chemical analog to the mother dog calming pheromone. This is what the mother dog makes around her breasts so that those squirming puppies will settle down and latch on and eat. Of course, if they didn't settle down, they'd never eat. We all know what would happen then, right? So all dogs still have the receptors in their brain, no matter what age they are. The aging dog still responds to Adaptil. Okay, so this pheromone now goes to, when it's inhaled through the roof of the mouth, there's actually a neural afferent nerve pathway to the calming center of the brain, that when the pheromone goes to those receptors, it can lower heart rate, help with physical relaxation, and especially like social interaction. Like, oh, hi, you're actually nice. I might want to come up to you. Okay. It is made by the Zebra Corporation. It's available in a spray, a plug-in, meaning, what you put in the outlet in the wall to evaporate a cloud around the room. And then lastly, a collar. The collar, it's just the body heat warms up the pheromone to be absorbed through the roof of the mouth. For most immediate, like right now we want to get the benefit, the spray, put on a bandana, or you could see somewhere that it's going to be, being absorbed up through this, like evaporated to be absorbed through the mouth. That's where you get the fastest effect. And you can get benefit within 5 to 10 minutes after putting it on. Okay. Fellaway is made by the Zebra Corporation, and they're actually two different products. The original one, made I don't know how long ago, at least 12 or 15 years ago, I guess, is the copycat to the feline marking pheromone. That's the pheromone that's up here in their little, where it's sparse up on their forehead and to the base of their chin. So when we put this spray or the plug-in on objects like the carrier or the cloth covering, the carrier on the exam table, on our forearms in the cage, to the cat, they feel like, oh, I've been here already. And that is how the cat feels like, well, if I've been here already, it's not so scary, because this marking and co-scenting is so important for cats to feel that, okay, not such a scary place. Now, there is also a feline, a calming or mother pheromone that was identified a few years ago and brought into a product called Feliway Multicat. And at presently, at least available in the United States, I am not quite certain what is available in Europe or other parts of the world, but the feline mother cat or appeasing pheromone is available in this plug-in. So it just like similar to Adaptil for the dog, has the cat calm down and to be more mentally calm. Now, SIVA found that if the classic and the multicat were combined in the one diffuser, the combination of the two pheromones blended was even more effective than either one alone. So that's why I think for an exam room, that Feliway Ultimate is really good, because you're going to get that benefit as well.
Yeah, that's so interesting. And, this whole thing about pheromones makes me think about, about what we do in practice. So, one of the things when I had my vet rehab practice, and this is a conversation that has come up a few times in some Facebook groups, people talk about clipping nails in vet rehab practices, expressing anal glands, because we can do that.
Yeah.
And I must say, it's one of the things that I just decided not to do in my practice, and mainly because there's a lot of fear associated around that. And my worry was the fear pheromones would be spread around my practice. And then when another dog would come in, they'd be like, oh, bad things happen here, as they get in normal vet practice. Is that something that can happen? Is it something that you'd recommend that we don't do? Obviously, in a dog that is not scared, it's okay, should be okay. What is your thoughts around that?
Well, I think, again, kind of going back to your journey in life, I remember one veterinarian when I was in vet school, I did an externship with, whenever right outside of his laboratory, where they do the fecal samples, etc., was a window and a garbage can to throw all that outside. He would not allow any stool material, blood or anal material or urine in the garbage can in the exam room, really to minimize odor. It was all about odor control for the client perspective primarily. Okay. But in the end, I realized, what, as I learned more about behavior, I thought, damn it. And so I did that myself too. I just was like, nope, no stool in the lab. You throw it outside. If we needed to do anals, maybe they were full, whatever, blood draw, etc., all this goes outside. We want to minimize and prevent as much odor in the office for just general, whatever you want to say, acceptance by clients. And hey, well, then the more I learned about behavior, I realized, what? The only time an animal will smell the blood of another animal outside of if they hunted them is if the other animal is injured, right? So that's going to tell the other animal investigating this, like, whoa, something bad really happened. The only time an animal is going to defecate or have, especially have anal gland secreted, is high fear or high pain. Again, it's going to tell this other animal, whoa, something bad happened in here. So I realized, boy, this makes complete sense to get this out of here no matter what. And it doesn't take that much work. My goodness, it's just room cleanup, right? You wear your gloves, you take them off, double fold them with the towel, and that goes outside. It's just enforcement, and being mindful of it. But like any other kind of tidiness, that is what you do. Or make it handy like Dr. Fairley did. He had a garbage can right out the window. You just open the window, goes out that way, and it's not even in the room. So there are specific pheromones. That is true. There are specific pheromones in the stool of dogs that tell dogs what dog was there. Cortisol is secreted in the urine. And dogs are very adept at sensing that. There are studies actually have been done on, dogs sensing cancer in people, etc. But we do know cortisol is in the saliva, cortisol is in the stool, cortisol can be in the urine. And these animals can sense tie or not, between each other. So we humans, I don't know how good we are at doing that, but we certainly don't think about it. So I think that's all a part of the pheromone communication between animals. And you're absolutely right. Yeah. Get that stuff out of there, because even though nobody died in this room, but if the animal smells, the cotton ball with maybe some blood on it, or the, syringe needle cap or whatever, to them, they're going to think something bad happened there.
And if, let's say, you clip a dog's nails, right, and the dog is extremely fearful, are they going to release pheromones that are going to linger there, that the next dog that comes along is going to think, hey, what happened in here?
It is likely true. There, to my knowledge, are not a lot of documented studies about specific techniques and pheromone secretion, and then the ability for the next animal to evaluate that. Okay. So because there's a lack of scientific study and scientific evidence, I can't really say that directly, but I would say from anecdotal experience, yeah, you can see in a dog who might be like, oh, fine and happy, and like almost that, ooh, what just happened? And here, the ears going back, the eyes getting wide, in a room where maybe, let's say, there was a hit by a car or something. I mean, or an animal that was in high fear. And we do know, so I would say, yes, I think that is also a reason for a big reason for keeping, the anxiety lower. Animals telegraph it in lots of different ways, whether it's vocalization, the animal meowing a lot or barking a lot in the waiting area or in a treatment area or another room affects the other animal in another exam area, even if nothing's happened to them, even if they're just sitting there waiting with their owner.
So you mentioned earlier about animals that are in pain are even more noise sensitive. What is other things that pain affects and change their behavior?
Two things. It increases anxiety and it increases aggression. And this is a direct correlation, a direct effect of serotonin is not only an important chemical for modulating mood, it also is an important body chemical for modulating pain perception. So when there's chronic pain, the body's been like utilizing its own serotonin, so that's going down. So we oftentimes will, and if you even look at the body language of pain and the body language of anxiety, the body language signs are similar. And it's often because these changes in the neurotransmitters are similar in both situations. So I'd say number one is anxiety will increase. And I have seen in some of these aging dogs who were, say, fine during a thunderstorm in their youth, but now at age 10, and they also have a partially torn cruciate ligament, now they're startling more readily to noise, or they're really upset about thunderstorms. So anxiety, it goes up, as well as aggression. So aggression can happen not only in the moment of touching or handling their body, but you may see increased resource guarding. You may see that this dog now will start growling at people walking by, or maybe even approaching them, which normally a dog would have been very friendly for petting. And again, this relates to the changes in the neurochemicals, but then secondly, also I think a little bit of body guarding. It's like, hey, I don't want you to touch me because my back is killing me right now. It's hurting right now. So people usually walk forward, they're going to reach, they're going to touch your body. Now is not the time, is what the animal is saying. So aggression increases, and it can increase not only for handling, it can increase in other ways. Resource guarding is a common one, and then touch, anything related to touch. And then secondly, yes, anxiety increases.
Yeah, it's interesting you mentioned that in older dogs, we suddenly start to see this. And I wonder how many times those dogs are sort of diagnosed with a cognitive dysfunction when actually it's actually pain.
Yes, and that does, I don't want to say it's difficult, but again, the body and the brain always work together. They always do. We need to just kind of remind ourselves of that. Again, it's that sort of that's technical separation, you know what I mean? That in the schooling, etc., we now are like pulling apart what you observe, what you see, how the body is responding versus, well, what is the temperature, what does the blood work say, what does the x-ray say, what is this response to a drug, like the technical, but the two always come together. So yes, a lot of times, oh, he's anxious because it may be cognitive dysfunction, it may be pain, it may be both together. So you always have to assess and manage both, and then assess what is the response, right?
So you were giving us some tips for how we can manage those anxious patients. You'd mentioned the first one was to decrease noise when they come in. Maybe think about bringing them in through the back door. The second one was you suggested using the Feediway or the Daptil. Is there any other tips and advice you can give us for those anxious patients?
Really, I think if you can, and you can are able to, or giving some pre-exam supplement or medication that may combine pain relief and improve the brain chemistry, that can decrease anxiety. So medications such as, say, gabapentin, because gabapentin not only is going to decrease how fast the neurotransmitters are sending up that signal, which is part of the pain perception, pain cycle. Gabapentin facilitates how serotonin goes into the frontal cortex. That's how it's also helping to decrease anxiety. So to keep in mind, maybe we should go up on the gabapentin because we'll get that dual benefit. Think of like dual benefit. Tramadol, as I know it's a narcotic, gives the pain relief as a narcotic, but also tramadol increases serotonin in the brain. So keeping that in mind is like, okay, if I'm going to need a narcotic, how about tramadol rather than just relying only, say, on trazodone? Okay, so I think thinking of pain relief, especially pain relief that will directly reduce anxiety. Secondly, our supplements and our diets. Can we get this animal on like our omega-3 fatty acid supplementation? Can we get them on, the joint relief, or even there are the brain diets now that help a lot with their not only their cognitive ability, but just the impact of, body inflammation on the brain and how that accelerates brain aging. And then lastly, really know your low stress handling techniques, understand and know how to read quickly when the animal's, signs are increasing for anxiety, and think to yourself, what just happened? Can I get the animal away from it, or it away from the animal? If it's noise, can we somehow, let's get to a quieter room? Can we ask everybody, hey, can you put the phones on quiet, or throw some food or something to the dog barking in the back because he's upsetting this cat up here, that type of thing.
And do you have any tips for our equine vet rehab therapists?
Yes, well, I don't directly practice in equine medicine. I do have quite a few friends who are veterinarians and equine behaviorists. I'm really reading that equine horse body language well, and horse behavior and horse reading body language, etc., like these charts and ladders of aggression, are so far less than they are in small animal, but they are there. So really knowing and understanding the proper way to approach a horse, how the horse is showing with their body posture and position. Again, be preemptive with pain relief on our horses and anxiety reduction. I believe in Europe there is a horse calming pheromone spray, and made by the Seva Corporation. I don't believe it's available in the United States, but there are products like that. A lot of people use, say, lavender essential oil on the horse's face, maybe 20 or 30 minutes before starting the physical exam, because lavender will help to aid with calming. And again, environment, boy, oh boy, having those horses, of course, they're a flight animal. They're going to try to escape, and if they can't, then that's when they will turn to aggression. So we need to be very mindful of the space that we have them in. That's also going to be low stimulus for them, and giving them an ability to feel like, well, I could get out of here if I need to, because oftentimes for the horse, that helps to reduce their anxiety, than to feel that they're entirely closed in a very walled in space, that we cannot escape from. Then that can increase their anxiety.
Thanks, Eddie. That's all great tips that you've given us. So thank you so much. If someone wants to find out more about what you do and the training that you give, where would they be able to find you?
Best place would be to go to my website, and that's drsallyjfoote.com. And at my website, I have a tab for the veterinary professional, and under that tab, you'll find a lot of handouts that are free, like ladders of aggression, top 10 ways to add a pet to your home, different things. I also have a shop where I provide on-demand veterinary race approved continuing education for the veterinarian as well as the veterinary staff. And I also have some courses and seminars for the client level to help them with their pets with handling or behavior. So my live seminars, I do offer in person as well as live stream. So for the international audience, you can attend that, and they are available for continuing education. Lastly, I do provide some on-site staff training as well at clinics. Thanks.
Awesome, Sally. Thanks so much. So for those of you that are interested, we will put all the links in the description. Sally, it's been great chatting to you. Thank you so much for sharing your knowledge. And
Thank
and
you.
I'm looking forward to following you and learning more about stress-free handling.
Well, you're very welcome, and I really appreciate you doing this podcast and helping veterinary professionals and other people to really learn about what we have available to help our animals and continue to improve veterinary care. Thank you.
Awesome. Sally, have a great day.
You too. Bye-bye.
Bye-bye. If you enjoyed this podcast, please hit the subscribe button so you get notified every time I load a new podcast. I'm here every week talking to vet rehab therapists from all over the world about all things vet rehab. A big thanks to our sponsor, Wiggleless. Their sponsorship allows us to be able to give this podcast to you for free. So please go and check them out at wiggleless.com. Don't forget to also bookmark the next Vet Rehab Summit. It's on the Saturday, the 12th of November. I invite you to come and be a part of the world's largest online veterinary rehabilitation conference, created specifically for you, the vet rehabber community. Onlinepethealth members get VIP complimentary access to the Vet Rehab Summit. For more information about continuing education for vet rehabbers, you can go to onlinepethealth.com.